As doctors, we are well aware of mistakes that we try to avoid while treating our patients. Mistakes like prescribing the wrong medication or prescribing a medication that our patients are allergic to, misdiagnosing a condition, just to mention a few. But that's not even the worst part. The worst mistake we as doctors can do while treating our patients are those mistakes that we are not even aware we are committing. Welcome back to my channel. I'm Dr. Duncan, Dr. D, and today we're talking about the worst mistakes that we as doctors can do while treating our patients. So let's just jump right into it, shall we? The first mistake that I want to mention that we as doctors do is overprescribing. What am I talking about? A patient comes in because he has high blood pressure. So the first things that we do, we just take the blood pressure and it's high. It's high, you have high blood pressure. So I'm going to prescribe you a medication so you can control your blood pressure and you don't suffer from the conditions that can happen afterwards, like a heart attack, a stroke. So I'm going to give you this medication, and not only I'm going to give you medication for high blood pressure, but because eventually you can develop stroke, I'm going to give you medication for high cholesterol and baby aspirin to avoid that from happening. I'm going to prescribe you medication for a heart condition which you don't have, and you're going to take it for the rest of your life just because I don't want you to have it. And that's my justification. And in medical school, they teach us this is the condition and this is the natural evolution of the condition. So this is the medication for that. Or preventive method, it's prescribing medication before you get that condition. Are you guys following me? Instead of telling, okay, the pressure, your blood pressure and this reading is high. What's going on? Talk to me about your family, your way of life. Are you eating all right? Are you doing exercise? How is your stress level? How do you manage stress? What do you do for a living? You have a family? How is your dad? These are questions that are key to understanding our patients. But if I don't have time to ask those questions, I cannot get into the conclusion. And you feel like, yes, I'm doing my job. I don't have time to answer and explain how things works, but I'm going to make the most of the time I have and prescribe a medication that you'll need in the long run, that you'll need eventually. And when the side effects kick in, then you'll come back and I'll just prescribe you other medications to counteract those side effects. And I'm doing my job. It's all about taking time. Which brings me to mistake number 2. No time. I have no time to explain. I need to see patients. I cannot spend 30 minutes, 45 minutes, God, an hour with a patient. I just can't. And I know because I was once one of those. Before I opened my own practice and I could take the time, I was miserable. I was just stressed out. I was seeing patient after patient, and at one point I just lost the joy of attending as a doctor. And I say that this can't be. And I hear you. It is tough. It's hard. Once I spend 3 hours with a patient, and I'm not saying by no means you have to do that, but sometimes you have to. Sometimes the patient just wants to vent. And there are some environments where you can't. I have the blessing of having my own practice, so I can do that when it's needed. I mean, it's not fun. After that, after 3 hours, after 2 hours, you just you need to let go, because it's a lot of stress, a lot of information, but it's necessary. Sometimes a patient just come for his refill prescriptions. Sometimes from a common cold, and it could take 10 to 50 minutes. But sometimes you have to spend more time. And especially when you are seeing patients for the first time. If you don't have time to take care of your patients, there is no way you're going to make sure that they receive the treatment that they need. You can prescribe the medication and they'll feel better for a while, but if you don't get into the nitty-gritty of the situation, you have back pain. Why is that? What do you do for a living? Do you spend a lot of time sitting down? What does your diet consist of? How are your sleeping hours? Do you sleep? Is your bed comfortable? When you wake up, do you feel the same way? Or during the day you feel better or worse? How long has this been going on? Have you had a previous accident? You are unable to sleep? What's going on? Are you stressed? How is your life situation? Are you married? How is your marriage going on? How is your work? You have stomach issue. Are you eating correctly? Are you eating your 3 meals a day? Are you sleeping? Are you taking time to take care of yourself? Are you exercising? Everything is connected. Everything is connected. But if we don't have the time to explain, because this is the thing, we as doctors have 2 major functions: to cure the immediate situation and to educate so the patient can take care of themselves. Preventive medicine, there's nothing stronger than that. And when I say preventive, I'm not talking about prescribing before the patient gets sick. It's about educating on how to live in a healthy manner. Why does sleeping matters? Why drinking X amount of glasses of water matters? Why? Why is taking time for yourself, breathing, just venting, relaxing, eating healthy, why does it matter? What makes sense of it? Explaining how patient got to point A to point B. And this is your baseline, and this is where I want you to be. I always tell my patients, if you understand the part that you play in your health, then that's power. It's easier, then it's going to come natural. You'll know exactly what to do, and oh, this makes sense, and it will just be it will be easier. It will be easier for you. But the lack of time is just killing our joy as doctor, and it's killing the way we do medicine. The third mistake that we often do without even noticing it is that we treat the patient as numbers, as parts. Okay, yes, what are you here for? I have a flu. Okay, flu. We zoom into nose, throat, maybe lungs. And we treat that. Yeah, because I have a fever, I have a headache, yeah, it's all related. And we give medication, prescribe medication, and go on your merry way. Yeah, I come with a back pain. Zoom into the back. Okay, back pain. Treat your back. Knee issue. Stomach issues. So we see patients as hearts, colon, throat, muscle, lungs, kidney. We dissect the patient instead of concentrating on the patient and seeing the patient as a whole person. If you are having blood pressure issues, what's going on? Blood pressure, okay, the heart, circulation. But are you having a diet low on sodium? Are you exercising? How is your stress levels? So I'm repeating things that I already said, and I already said in other videos, but because it's important, lifestyle changes are way more important than any medication that you can take for your current condition. Because you could be living just taking your medication and having your issues controlled, and all of a sudden you died from a heart attack, you had a stroke, and all of a sudden, how strange. He was only 60, 65, 70 years old, and he had a heart attack. Well, that's normal nowadays. That's normal. But his blood pressure was always under control. But he wasn't doing nothing. He was masquerading the symptoms. He was just getting good numbers under medication. But what the body needed, it was to take care of itself. It was exercising to relax the muscles, to help with the circulation, to release that stress on the heart. It was sleeping hours. Because only when you sleep is when your body repairs. Not by taking medications. It's when you're sleeping that the body regenerates. The cells are damaged, they regenerate. He needed to eat better so that all that sodium wouldn't damage the kidney and elevate the blood pressures and make little cracks on the blood vessels. But because I didn't pay attention to that, I was just masquerading these numbers. The body did until the body could no more, and it just eventually expired. We shouldn't have dementia at 75, at 80. Parkinson is not normal, it's not natural. Internal inflammation, that is not normal. We've been accustomed of living with these conditions because of our lifestyle. And the ones that should tell us what to do or explain the situation and steer us from that path, we are too busy seeing numbers. Patient number 476 has blood pressure of 170/102. Has 3 days having this condition. It's numbers, numbers, numbers. When the only number that should matter is number one. Is there one patient that I have in front of me sitting down? Is one person that has a back pain. I want to see what that back pain is related to. If he's stressed, if he has a muscle spasm, if he has a kidney issue, like it's a whole. What is he eating? How many glasses of water he's drinking? Is he exercising? Is he stretching before exercising? But if we go back, we don't have time to explain because there's no time. So I'd rather go back and prescribe medication for the back. So the problems just overlap, and because we all do it and the patient feel good, you take care of the problem. Blood pressure is under control, diabetes is under wrap, the pain is gone. We said, good job. But there's a better way. There's a better way. We have to find the time to meet our patients and just talk to the individual. Like I would love a doctor talk to my mom, to my dad, to my baby. The way you talk to your patients is the ideal doctor that you will want for your loved ones. Taking time, caring for them. Patients deserve better. They deserve your time. It's okay to say, I don't know right now what's going on, but I promise we're going to figure it out. And take time to figure it out and explain it to your patient. It's once you make the change, it's amazing. It's so special. You end the session thanking the patient because every time you interact with a patient in that manner, it's an experience. You learn, you grow, you become better. Because we have to remember, patients are individuals. You could study all your life and you'll never know the body of that patient sitting in front of you like they do. Because they're living with it. They know the little nuances. And what makes medicine special is that not two patients are alike. They could be twins, they are not alike. because their personalities, their experiences, what they put into their bodies, it's different and makes them unique. So should be the treatment. There should be no one treatment for diabetes, one treatment for cold, one treatment for your immune system. You have to meet the patient where they are. You need to get to know the patient. Individualized medicine is not the future, is the only way of doing medicine, is the best way of doing medicine. After you talk to the patients, then you ask for certain labs. And then you explain and say, this is happening because of this, so this is what you need to do, lifestyle changes, and if needed, this is the medication that you need to take, of course, because when it's necessary, there's nothing better than medication when it's necessary. But it always has to be tied with lifestyle changes. And you as patients, you deserve a good doctor. You deserve to find a good doctor, someone that listens to you, someone that look at you as an individual, and it's really, really interested in your well-being. So if you need to find a second opinion, do that. Don't feel bad, it's your right. It's your life. So in the next video, we're going to talk about mistakes that we as patients commit as well. Because, oh yes, we as patients, we can commit certain mistakes that we want to avoid for our own good. So thank you for joining. I promised myself that this year I would be more consistent. So every week I'll have to be consistent and drop a new video. So until next time, take care of yourself. 2025 is the year of taking your health to the next level. So see you on the next video. Bye bye.